Welcome back, folks. We're pleased to be joined by our longtime friend, our good friend, Judith Schmidt, who is the CEO of New Jersey State Nurses Association. Judy, how you doing?
Doing well. Thank you, Steve.
Judy, we've talked about nursing, the profession of it, how incredible nurses have been for a long time before COVID-19. How great are they now?
You're absolutely wonderful. As you know, we're superheroes now. We wear capes and cure the world.
Yeah, but you knew that for a long time before that. What are they facing, as we do this program in mid-May, and what do they need moving forward?
So things are a tad bit better for most nurses in New Jersey. We still have a lot of issues with personal protective equipment, support services, and also in other areas. We focus a lot on acute care hospitals, but there's other areas where nurses work, such as in long-term care facilities, also in home health, in group homes, and we don't have the resources that are needed, especially in these other than acute care environments.
You know, Judy, it's interesting. We've been talking about nursing and nurses for a long time. But what it strikes me is that there's certain kind of people that go into nursing, extraordinary people, empathetic, caring, clinically competent, strong leaders. What do you see as the future of nursing moving forward, given the fact that there have been so many media reports that accurately depict the incredibly painful, difficult life of nurses on the front line in the age of COVID-19? Do you think there'll be fewer people wanting to go into the profession?
It's a very, very interesting question. I think the answer is it is unpredictable as the virus is unpredictable. As you know, we were going into a nursing shortage anyway.
That's right.
Had seen shortages in the critical care arena, even in our most sought out positions in our labor and delivery suites. So there is a concern that we will not have as many young men and women going into nursing as we've seen in the past. But we also know that there may not be a lot of positions available. You know, in addition to being a healthcare crisis, this is a little bit of an economic crisis. And it really has hit our healthcare arena very strongly. And we've heard of areas where nurses have been furloughed, layoffs. So it's very unpredictable what the balance will be. My gut is that we will have a shortage, that there will be enough positions for anyone who wants to enter into the field of nursing. But again, as unpredictable as the virus is, where are these positions going to be, and will there be enough people to fill them?
You know, Judy, I'm curious about this because we've talked to so many healthcare leaders, hospital executives, others, who say the world of healthcare is going to change dramatically. Does that mean that the job of nursing will change? Meaning, I'll be more specific. If telehealth, telemedicine will be more prevalent and dominant than ever before, will it mean that nurses have to learn to communicate and interact remotely in a way they never have before?
I think, yes, they will. I think we've started to do that. We know that there is telehealth. We know there are nurses that are doing telehealth now. We know there are nurses that in the past have done telehealth through phone calls with patients after discharge, or nurses that work in insurance companies that check up on patients. So we do have a little bit of that telehealth in our background. But the most important part about nursing is the caring and the touch.
That's
We
right.
will still see that, of course, you know, in our healthcare facilities, our hospitals, our long-term care, our home care patients, et cetera. So yes, there will be an even balance of the telehealth and technology, but the most important part is we need to keep the touch and the caring aspects of the profession of nursing intact.
In the limited time I have left, I'm going to ask you this. With so many challenges around PPE, protective equipment, right? With so many challenges around the number of hours that nurses are working, what they're seeing in the age of COVID-19, serious illness, and obviously death. How do you think most nurses keep their spirits, their morale up and positive?
Well, I think there's a lot of ways. I think the collegiality amongst the nurses that work in those very high stressful areas, that is very helpful. I will tell you the New Jersey State Nurses Association has a group called the Healthy Nurse Healthy New Jersey team, and they offer every week a moral resilience webinar, live webinar that any nurse in the state of New Jersey can join. So I think it's a matter of us all working together,
Mm.
talking things out. If we do find that we're too stressed, anxiety ridden, then that's the time that we need to seek help with our professionals. We're again fortunate enough that we have psychiatric nurses in advanced practice that
Right.
are all there willing and ready to help any nurse who may need assistance in coping with this extremely stressful ordeal that they've been through.
Judy Schmidt is the CEO of New Jersey State Nurses Association. We've been colleagues, friends. We've done nursing programming for many, many years together. It's never been more important than it is right now, not just to celebrate and recognize our superheroes, as Judy well said, but frankly, to just remember what they need to be the best they can be, to be effective, and to make a difference in our lives, along with physicians and other clinicians on the front lines. Judy, thank you so much. We appreciate everything you and all of your colleagues do every day for us. Thanks, Judy.
Thank you, Steve.
I'm Steve Adubato. We thank you so much for joining us. Stay safe, be well. We'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by New Jersey Sharing Network, Atlantic Health System, TD Bank, New Jersey Board of Public Utilities, Clean Energy Program, Seton Hall University, Operating Engineers, Local 825, the Port Authority of New York and New Jersey, Gibbons PC, and by Eastern Atlantic States Regional Council of Carpenters. Promotional support provided by Insider NJ and by ROI-NJ. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.